Okay, we're going to talk a little bit about bleeding and wounds. We all know what human blood tastes like, yeah? No, I'm joking, it's just if you cut your finger, we've all cut our finger or grazed your knee at one stage or another. There's different types of bleeding depending on what vessel the blood is leaving by, whether it be arteries, veins, or capillaries. They're all different kinds of bleeding. And the aim of this unit is to be able to tell the difference between each type of bleeding and be able to tell that to be able to treat that, before a paramedic gets here. And finding and stopping bleeding is a part of your primary survey. If you can find and stop bleeding, you're going to give your patient a much bigger chance of survival. So that's one of the first things that you do. Direct pressure you use it on all wounds, bar one. I'll show you that later. And we have 6 litres of blood in the body, and we need them 6 litres. That's 12 pints. Doesn't sound like a lot to keep us going. We need that to live, so the more you can keep in, the better. We'll start off by talking about arterial bleeding. Arterial bleeding is when an artery is cut. An artery is where blood is oxygen rich, it's bright red in colour, and it's going away from the heart, and it leaves in a spurting motion, so it goes a good projection and hit the roof. So it would be like at a kind of rate of your pulse. So it's bright red in colour. The way we treat that is with direct pressure. Venous bleeding, it's dark red in colour, and it leaves in a steady flow. So it's more of it doesn't have as much pressure as an artery. Its colour is because the oxygen has been used out of it, and it leaves like a chug. So that kind of emotion and a steady flow. It's the blood on its way back to the heart. Okay, the best way to treat the venous bleeding is with direct pressure. Capillary bleeding. We've all scraped our knees, scraped our elbows, maybe a chin or two here or there, and the capillaries are what feeds your skin. Basically, it's the little capillaries that is the last source of survival for your skin. If you take off a couple of layers of skin, the capillaries will still think you're feeding the skin, and it will ooze out slowly. It's bright red in colour, not quite as red as in arterial bleeding. It usually stops on its own, but if it doesn't, the best way to stop it is with direct pressure. To control bleeding, we use the PEEP method. PEEP is, the first P is for posture of your, so if your casualty is bleeding, you lay them down and keep them warm. The next E is elevation. If you elevate the legs, your legs act like a reservoir for blood. So if they're laying down already, you have them nice and warm, raise up the legs, and the blood will flow down to the organs where it's needed. The next one is examination. If you examine to tell what type of bleeding it is, when the paramedics get here, if you say, alright, it's an arterial bleed, they'll know to act that little bit quicker than if someone's just after scraping their knee. You're not going to call an ambulance for scraping their knee anyway, but if you're able to tell the paramedics as much information as possible, that's all the better. The last P is pressure, famous pressure. All these type of bleeding, apply direct pressure is the quickest and best way to stop bleeding. Okay, so we go through that again. Just you reassure and calm your patient. You keep your patient lying down and warm, and if you can, raise the legs. That's if the injury is allowed. If there are broken legs or any complications like that, you might not be able to do it. You loosen any restrictive clothing, so the buttons, belts like that, so it'll help with breathing and also with blood circulation. Give nil by mouth. You don't want to give them anything to eat or drink, and you may expect to have vomiting occur. So if they do vomit, you want to be ready to move them, put them in a recovery position, and that'll stop them choking on their own vomit. You need to check the vital signs every 5 minutes. So that's check your pulse, keeping the airway open, and make sure they're breathing. Okay, so call them a CAB, C-A-B. Circulation, airway, breathing. Internal bleeding. Internal bleeding, it isn't always clear if someone has an internal bleeding going on. Like a bump on the head can be an indication of internal bleeding. A bruise can be an indication of internal bleeding. You can lose enough blood from internal bleeding to cause lung and heart failure and cause death. So you can assume internal bleeding if we have blood from the ears, the eyes, the mouth. If you're coughing up blood, it would be also if you're vomiting up blood, it will be a brown colour. And then you can assume that someone has internal bleeding if that is the case. Bruises on the chest or rib fractures. With a rib fracture, you'll see a bump where the fracture is, if it's a bad one, or maybe protruding, it could be coming out. We can assume that there's internal bleeding. Abdominal area can become rock hard and very, very tender to the touch, so they might not get touch them anywhere in there. So, and there can be blood in the urine, and that would be a grey colour. There could be rectal or vaginal bleeding. If you're bleeding internally, it has to leave somewhere, so it'll leave anywhere it can leave. And if there's fractured bones, your bones are surrounded by flesh, so if a bone breaks badly, it's going to tear some of that flesh and cause bleeding. Okay, signs and symptoms. We have restlessness and weakness, and you have an altered level of consciousness after coming in and out of consciousness. We'd have fast, shallow breathing, so that we're breathing with a panting sort of a breathing. These are all signs and symptoms of internal bleeding. A fast and weak pulse, if you're having trouble finding a pulse, that's a weak pulse, and it'll be racing, so it'll go up, up, up. Okay, you'll have a drop in blood pressure. You might not have access to a blood pressure monitor, but there will be a drop in blood pressure. They'll have pale, clammy skin, and they may ask you for water as they become thirsty. But as we said before, nil by mouth, so don't give any water. Now we have types of wounds. There's 6 types of wounds. Now, graze is the first one we're going to look at. What kind of bleeding would you say can occur on a graze? We're after taking off a couple of layers of skin there, and anyone, what type of bleeding would they say could be? Capillary, that's correct, well done. You're just after taking a couple of layers of skin off, and the capillaries are still feeding the skin, so it'll ooze out red colour. Anyone tell me what kind of red? Bright red, but not as red as? Well done, good stuff. The next type of wound is a contused wound or bruise. Now, it can be an indication of what do you think? Internal bleeding, well done, yeah. What would you say is the best way to treat this? Is with
direct pressure.
Direct pressure. Right. A laceration. It's usually done with a straight, bluntish object, and it won't be a clean cut. And what type of bleeding would you say this could cause?
Arterial.
Arterial. I'll give you a hint, it's more than one. Venous.
Capillary as well.
Capillary as well, yeah. Yeah, all of them really except internal. because it's not internal anymore. It's been opened up. So whatever was bleeding inside can out.